Bismillahirrahmanirrahim. Assalamualaikum. Good morning. Well, welcome to this first session of the day. And I'd like to thank KSI for inviting me to be here. Now, the topic given is the new competitive landscape in healthcare. I don't know what the organizers expect from that. Going to be very interesting. But we got a very distinguished and interesting panel this morning. We got Mr. Tirupathi, Karthik, who is the CEO from Napier Healthcare Solutions Proprietary Limited from Singapore. He cannot travel here, so he'll come through Zoom. Mr. Rangam, he's the CEO of Gibraltar PSN Life Berhad, a major insurance company here. Dr. Raymond Choy, he's the founder and CEO of Dr. To Us, and Dato Dr. Kuljit Singh. Kuljit is the actually NT surgeon at Prince Court Hospital, was very active in the Malaysian Medical Association, but he's here as the president of the Association of Private Hospitals, Malaysia. Now we got 1 hour to discuss this theme, this topic, and I'll attempt to try to set the scene. Can I have my slides? Okay. All right. So I'll just mention very quickly about competition in healthcare. The new landscape, the panel can handle it. Competition in healthcare is a very, very big topic, and we cannot hope to attempt to cover it in a very major way. But let me give you some highlights. People working in healthcare, where is it? People working in healthcare work very hard. They're highly committed. They're very focused. And really, they work their guts out. I mean, what you see under COVID-19 is just one aspect of it. They've been doing it all the time, very quietly, behind the scenes, and we don't know very much about it, actually. But despite their dedication and their hard work, the care in healthcare has not improved. In fact, healthcare around the world is hopelessly fragmented. It is not sufficiently effective, not sufficiently productive. It remains as, mentioned by Daphne and Ted Lee in the Harvard Business Review, their article in 2016. It remains chaotic, unreliable, inefficient, and crushingly expensive. Can you imagine 30 to 40% of healthcare spending is waste? In the US, if they spend $4 trillion a year, $1 trillion is utterly wasted. Well, there are many solutions being put up. And one of it, which is core to most things, is that healthcare needs more competition. If you're all interested in this important topic, look up Michael Porter's research. Michael Porter from Harvard Business School. He started research on this 20 years ago, and he published a book on redefining healthcare. Harvard Business School, 2006. You see, we are in a market economy. In other sectors of the economy, competition can result in improved quality, improved efficiency, and spurs innovation. And it can drive down cost. But not in healthcare. Not in healthcare. So why does this not happen in healthcare when it happens in other sectors of the economy? Well, healthcare attempts to manage competition, manage, inverted commas, by consolidating, buying up market share, increasing bargaining power with insurers and suppliers. But does these mergers and acquisitions, does it result in better care? Does it result in lower cost? Does it result in better outcomes? Well, sad to say, no. Daphne and Dick Lee in this article showed in their research, it does not. In fact, it increases the cost of care. The Federal Trade Commission in the US, which is an anti-competitive body, their research done in the 90s also showed the same thing. Healthcare needs to compete on value, just like in the other sectors of the economy. What Michael Porter showed in his research, in healthcare, they compete on all the wrong things. You know, you see Kuljit Singh there. His hospital says, we got the best CT scan in the world. And somebody from Bantai say, we got this best MRI or whatever in the world. They compete on that so that we got more CT scans, MRIs in Klang Valley than the whole of Australia. And who pays for it? That's a problem. They don't compete on value. They compete on brand, on our technology, and so forth. So what are the barriers to competition? There's no financial incentive to deliver value. You know, people behave depending on incentives. There's no penalty for not delivering quality. You know, can you imagine how ridiculous the situation is? In Malaysia or US or anywhere else. US is changing, by the way, because they're going on towards value-based healthcare. When you go to the hospital or when you see the doctor, the patient or the funder assumes 100% of the risk. The doctor or the hospital assumes zero risk. How absurd can that be? You ask them, what is the cost of care? They won't be able to tell you accurately. Will I get better? The doctor also will not be able to tell you very well. There's a problem. So if you ask Kuljit Singh, hey, what are your results? Or you ask another doctor, what are the results of what you do? Whatever service it is. Hip replacement, tonsillectomy, what are the results? Oh, Kuljit will say, I am the best in Malaysia. I'll tell Kuljit, don't bullshit me. Show me your data that you are good. And that is not available. And why not? Why aren't we measuring performance and demanding it? That's how we should compete. The providers that actually deliver value, they are not rewarded. Sad. There's inadequate data on outcomes. Well, these are all major problems, you know. So, if we want to promote competition in healthcare, number one, hey, put the patient first. You know, none of this nonsense. This doctor got an elective operation, patient waiting and staffing since 6 a.m. and the doctor walks in the hospital at 11 a.m. to do his surgery. We should not tolerate that type of bloody nonsense. It happens. So patient-centeredness in care is critical and should be demanded. You must create a choice. You must stop rewarding volume. Payment system must change. Have more lump sum payments, bundle payments, capitation instead of fee for service. Yeah, sure, the doctors and hospitals scream. So what? They're moving towards this in the US. Standardize the methods to pay for value and make outcomes transparent. Well, I'm trying to set the scene. Huh? So now you guys, you got to ask the panel after their presentation. So first, can I invite our colleague from Singapore, Mr. Tirupathi Karthik, to make his presentation through Zoom. Huh?
Can you hear me?
Good. Thank you. Thank you. Yeah. We can see you.
Yes. Yeah. Thank you, Tan Sri Dato, Dr. Abul Bakar Suleiman, and also Tan Sri Michael Yo. I think these are very challenging times for all of us. I'm honored to be taking part in this Malaysian Healthcare Conference through Zoom and share some of my ideas. So I think before I begin my presentation, I think you have rightly put the spotlight on competition. And competition is, in my view, required. But I have a slightly different view on how that might come about with the help of automation more than trying to force competition, because like you rightly said, healthcare is a fragmented market. And especially for technology providers like us, fragmentation does not help, because innovation comes at a cost, and that innovation must be eventually paid for. Fragmented healthcare does not allow for better realization of costs, at least from the technology sector. I do not have much experience or knowledge on the other sector within the healthcare. And like you also rightly said, Tan Sri, the data is in the spotlight, and I'll probably share some of my thoughts about that. So what I had in mind today to share with you is the impact of COVID, what directs some of the investment trends consequently, the service models and the patient experience, and the recent innovation game changers. The impact of COVID is, in my view, very simple. It is forcing people, health systems, and everyone else who's a stakeholder in the healthcare to share the spotlight and provide care anywhere. I think that's, in a nutshell, what is happening to us. What this means is the unification of health information is required across the care continuum, which means people and their medical data must be available. The electronic medical records and the past history must be available to every care provider. And I think that's, in my view, the biggest outcome of these times of pandemic. That's making a lot of health systems reevaluate what must be done. I also looked at some of the recent reports that, for example, from McKinsey, and it gave us a very interesting view of what has happened with innovation. Innovation has changed, especially in the last 6 to 9 months. As of June 2020, a quick look at the VC funding patterns in the US actually show us that there are a few areas that are gaining a lot of prominence. Foremost, digitalization and data in healthcare is under spotlight. So digital platforms that provide care, that connect patients with behavioral health providers, for example, there is over $1 billion that has been poured into innovation over the last just 6 months in startups. I'm not going into VC funding and all of that. I'm just talking about startups. Similarly, the data and analytics, there's been about 620 million that has been funded. And some of the others that include innovations in care delivery and electronic medical record workflow tools probably take up another about $1 billion or so. So what this tells us is people all over the world are looking to solve some of these problems using technology. At the same time, I wish I could share this slide, but if you look at what has this done to some of the industries, let me see. I believe I can share my screen now. Yeah, if you can see my screen, yeah, that's good. Yeah, if you look at some of the industries that have done well since the pandemic and prior to the pandemic, you will notice, as I show you on the top, the tech-enabled industries are done fairly well. So amongst them, for example, the software industry has done quite well and has added about 275 billion a year to their expected economic profit pool. Some challenges, I don't know why this is happening. Yeah. Moving on, if you look at what we have looked at is also in terms of the artificial intelligence. Artificial intelligence, before I launch into one or two more slides on artificial intelligence, what I'd like to talk about is the often asked question about AI is, will it take over? So just to answer the naysayers, AI, the way it is built, we teach the AI engine what needs to be learned. Therefore, it is unlikely to learn something that we ourselves do not know. And so I would ask everyone who has some worries, anxieties about AI and its effect on healthcare, let me assure you, I have built AI solutions. My organization in Napier Healthcare, we built a few AI solutions. We know that that chance is probably not possible, at least in a long time to come. However, the other thing that I must also hasten to add is we all, as a result of the anxiety and fear, we kind of are having a hands-off approach to AI. On the other hand, I would argue the case for AI to be approached as a mindset, not just as a bunch of productivity projects or products which solve a particular problem, but AI must become a mindset in everything and anything that we do. And the objective must be that we should take the AI solutions and use it to determine what are the decision-making tools and outcomes that the key decision makers in an organization need before delivering care. So you can look at some of those which I have shown here on the slide, which is self-help management, affordable medical devices, electronic health records, so on and so forth. And that is what is the value of AI in that sense. Yeah. AI, therefore, must be infused in everything that we do, which means that we should be able to deliver AI using, we should be able to deliver telemedicine using AI, virtual doctor consultations, remote patient monitoring, integrated AI chatbots that actually help patients find their cost of the bill to be paid or to make an appointment or any of the other things. And eventually, as I said earlier, AI should be used to deliver care anywhere. And I think that's kind of the key to what we are looking for. I also want to talk very quickly about artificial intelligence and the age of pandemic that we are in. What many people will not realize is it can be used very well to discover hotspots of pandemic. So whether it be through analytics, heat map, using unstructured data. Unstructured data basically is talking about all the data that is available out there on the web, which can be used to understand some of these hotspots and emerging hotspots and discern a trend and quickly rush supplies and effort and people to those areas so that it can be contained before it blows into a full-blown pandemic. Similarly, it can also be used for contact tracing, as many governments have already done. We have one more idea which I thought I would share with the audience here today. It can also be used for the RGL management. the travel bubble, or the green lane that exists between Malaysia and Singapore, we can actually manage it more effectively by introducing an element of trust, which can be done using AI and blockchain together. So before someone comes out of one country into the other, you can actually ensure that the certificate that they carry, whether it be related to their swab test or be related to their, the certification of discharge, for example, if they have been warded in that country, they are all real and trustworthy. So that can be done through blockchain, and the AI can pick up the rest of the bits of making sure that the decision maker gets timely and intelligent data. So that's about the discovery in the pandemic and also the mitigation of the spread of the pandemic. I think that's how we can manage. More importantly, I think once there is someone who's unfortunately been infected by the virus, for example, AI can again come to the rescue in terms of detecting pneumonia through chest X-rays and the PLOS and the sepsis and some of the other use cases that are available. The pneumonia use case, if I may just add a quick minute to this, typically, radiologist has to go through hundreds of chest X-rays a day and sign them off. But what this can do is it can tell you that the top 8 or 10 of them are something that you need to immediately clear because of the following reasons. And then the radiologist looks at it and they still have to sign off on it, but now they are able to clear off the critical cases first and then get to the routine cases later. So that's one instance where it aids, for example, very clearly the work of a healthcare provider in this case. Similarly, it can also be the same chest X-ray can be used to look at cardiomegaly and a couple of 13 other, in our view, related classifications, as we call it. Lastly, I also want to argue the case that...
Mr. Tirupathi, your time is over. Can you finish
this is the last one.
In half 1 minute?
Yes. So the last part I want to talk about is AI can also be now used to get rid of the keyboard, which is a big impediment to productivity, and use the voice as your interface to interact with IT systems. So with that, I'll just like to stop. I'm sorry for exceeding the time. Over to you, Dr. Bakar.
Thank you. Thank you very much. Can I now invite Mr. Rangam to make his presentation?
Good morning, ladies and gentlemen. I won't be using slides, but I'll just express my ideas directly to you. First of all, good to see all of you very safe and healthy. I personally wouldn't have expected to actually participate in a physical event this year, but here we are, I think, which speaks a lot for overall the resilience of the human spirit, determination, and the sense of community, which I think has served Malaysia well through this pandemic crisis. And I wanted to thank KSI and Tan Sri Michael Yeo for inviting me and organizing this session, which is very, very relevant at this point of time. I want to create, since I have an insurance background, I want to bring in an insurance perspective, and also to the introductory comments made by Tan Sri on how do we spur competition in healthcare, how do we strive for better outcomes, and ultimately bring down expenses for all of us as individual citizens and patients. Little did we know when we started 2020 that we would be starting off with the defining healthcare crisis of our times, and with an unprecedented focus on public health, safety, and hygiene, which has brought about a lot of disruption, social disruption, economic disruption, and technological disruption. Social disruption, of course, has impacted families, friends, colleagues who have had to work separated across borders, unable to maintain physical bonds, but connected across digital screens. And we can also see that Karthik was able to join us digitally across from the border in Singapore. Work from home has become the norm and has become the standard operating model across businesses, schools, and even governments. And of course, we all know of the economic havoc that has been caused, and with the real possibility of living in an 80% economy for the next few years. All of this has led to the fastest acceleration of technological adoption ever, right? Who would have known that Zoom parties would be a thing? But digital connectivity, digital productivity, digital consultation, digital commerce, digital advice, digital payments, digital divorce, and also digital funerals have become a reality for us. Not by demand, but by necessity, frankly. And considering all of this, we were just discussing earlier this morning how some of those technologies have been in place since past several years, but how and what those technologies actually become the necessary public health infrastructure for the next decade. What I personally believe this crisis will lead to will lead the focus back into primary public health care, social health data and intelligence, prevention and care. And I want to share with you 5 broad trends in my perspective that will affect and reshape the healthcare industry. The first one, obviously, will be the acceleration of remote access, consultation, diagnosis. Access and convenience for citizens has always been a priority, but through this crisis, we have seen citizens being reluctant to physically visit hospitals and medical facilities, but they would still like to have trusted and reliable medical advice and consultation remotely if possible. And the operative words over here, in my view, are trust, credibility, reputation, and service. Just having a digital platform to provide the consultation and treatment is not sufficient to build the trust, to build the reputation, to build the credibility, service, and ultimately an uncompromising integrity of personal data. That is something that we need to talk about because that is what the whole digitalization will lead to. We have seen increasing trends in terms of consumers using digital, let's say, consultation. In the US itself, it has gone up from 15% to 28% in April this year. We know, for example, countries like Indonesia, which have 17,000 far-flung islands, which have severe medical shortage of doctors. There are only 4 doctors and 12 hospital beds for 10,000 citizens. In order to overcome such resource shortages, they need platforms like HelloDoc and AlloDoctor to have a network or infrastructure of 600 and 1,000 doctors respectively to handle COVID-19 related questions and consultations 24/7. The second trend that I will talk about is really change in consumer lifestyle choices and informed healthcare decisions. The major change is that consumers demand more control over their own healthcare. They want a better understanding of their health conditions, the kind of medicines and treatments that are being prescribed, and are willing to Google health-related information, right? So they are also rapidly engaging in healthier lifestyles, staying more active. We all know bicycle sales through COVID-19 have gone through the roof across many countries. But it is also the increasing usage of wearables, apps to track and maintain health, lifestyle, and other medical conditions. It shouldn't come as a surprise that Apple has now become the first $2 trillion company and is soon expected in the coming weeks to launch a new health and fitness platform to further stimulate this trend. The third trend I would like to highlight is something that also Karthik mentioned, is the power of data and leveraging artificial intelligence for medical diagnosis as the first level of filtering to reduce the burden on the medical infrastructure. We have seen InfoVision's coronavirus AI solution, which leverages medical imaging platform to spot COVID-19 from X-rays. You can use data analytics to spot trends in certain segments, in certain areas. For example, Common Spirit, a healthcare provider in the US, uses de-identified cell phone data to track mobility because mobility is seen as an indication of reduced social distancing, which increases the demand for medical support, medical infrastructure, and equipment. The fourth point that I would like to raise is e-medicine, promoted by e-commerce and digital payments. Amazon has just launched its online pharmacy in India to offer over-the-counter prescription-based medicines. they are able to use their market dominance and power to offer 20% discounts, thereby reducing medical costs for citizens. The last point which I will raise is, in the interest of time, is really the government-led healthcare infrastructure and platforms. Governments have a role to play. As I said, the focus will shift into primary healthcare. And governments have a role to play in terms of common standards, common coding of treatments, which will facilitate common electronic platforms which allow integrated health infrastructure across different providers using electronic health files and electronic health IDs. This is being driven in markets like China. The Indian government has just announced that there will be a single health ID for every citizen in the country so that you can have a consistent health track record over a period of time, developing health history, targeted outcomes to improve efficiency and reduce overall health expenses. And all of this is really driven by the citizens' willingness to share data more openly for the purposes of achieving better health outcomes. It can be safely said, as I conclude, that the next decade will be a decade of healthcare, and investments from private and government will stimulate further investments into new ideas, new innovation, and further investments into technology. We can all look forward to a very exciting 2020s on account of the virus, which has really focused and forced us to review our priorities and what matters most to us. Thank you very much, and I look forward to some exciting discussions.
Thank you very much. Our next speaker, well, maybe he might represent the future in healthcare, maybe. He's Dr. Raymond Choy, from doctor to us.
Hi, good morning, everyone. Okay, oops. Okay. Right. First of all, thank you, KSI, for the invitation, and of course, thank you, Tan Sri Abu Bakar, for the insightful sharing, as well as the introduction of myself. I think my sharing here would be a bit short and simple. So I'm representing the health tech sector. And particularly on the telemedicine and telehealth sector. So, I mean, looking at the current, the title, the competition, I think competition is inevitable in everywhere, right? And not only in healthcare and various sectors. But if you look at healthcare alone, we are in a very, very complex, fragmented industry where it involves so many parties, right? So we have the funders, the payer, we have the regulators, right, who actually want to move, but, with a lot of red tapes, not able to move so fast, to keep track with the technology, right? So much so they want to move fast along with the technology, but somehow because a lot of red tapes and governance, policy, compliance, they actually, limit them, not because they do not want to move, it's because a lot of all these, red tapes and bureaucracy, right? And at the same time, they do not want to kill innovations, right? So, and at the same time, we also have healthcare providers, from the private sector, the public sectors, and most importantly, the consumers or the patients, right? So we are in the industry with full of complexities, and how do we actually stay relevant and competitive to the needs of the people, not only to the consumers and the patient, but also to the healthcare providers as well. So when we talk about innovation, so, we heard a lot of innovation. If you were to ask me, innovation is actually is only confined to 2 words, which is to improve, right? So why do we innovate? It's actually to improve on maybe efficiency of the care, the healthcare costs. How can we bring down the healthcare costs? The transparency of the data, right? We are talking about the personal health record, which is extremely sensitive. How can we actually manage the data in a secure and safe manner? there are a lot of issues, where the server is, is located and how safe, whether it's a HIPAA compliant, things like that, So we are actually looking into so many factors, right? So, the innovation, not only on technology, but also on your processes, the flows, right? So the whole idea of innovation is to improve, right? So efficiency, the safer medicine practice, things like that. So I think we have been, listening to a lot of, value-based care all this while, right? And what is a value-based care? We talk about, to me, I think value-based care is actually about better quality of care, better outcome, which must be measurable, and of course with lower cost, right? So it's no longer, where, you pay higher, you get a better care. So if you look at our healthcare costs, and there are lots of wastages, like what Dan Sri mentioned earlier, 40% of wastages and abuse. You look at our healthcare costs and the insurance premium is getting higher and higher each year, right? So who are responsible? We are responsible for that. Not only the industry, but also the consumers and the patients. The mentality, the mindset towards healthcare is very different, right? So how do we actually tackle and, stay relevant to the needs? People or consumers, they are looking for better healthcare with lower costs, right? And we are seeing more and more patients, not only the B40 group, but M40 and even the top 20 group, right? Going towards the public sector for healthcare services, which we don't see this in the past 20 years, but we are seeing the shift. And because of, if let's say you are dealing with terminal diseases or chronic diseases, right, where it actually needs a huge cost, and how can you sustain, going to the private sectors where you have actually exhausted all your insurance, coverage? You have to go back to the government sectors, and not to say government sectors are not providing better care, and they are providing a good care services as well. But sometimes because of the load is too high, and and the priority might not be there. So it comes to a lot of challenges as well. So how do we actually improve all this by leveraging on technology? So in terms of telemedicine, where I'm coming from actually. So prior COVID-19, telemedicine or telehealth is alien, is foreign to this country, right? And how can you, we are about industry, right? Always get asked about this question. How can you examine the patient with the telephone, with the app, with just not even touching the patients? Yes, we can, but there are areas where we can actually, even when the first assess, we can actually assess the patient through the phone, through the telephone call, audio, video, or even text chat model. So there are a lot of ways how we actually can assess the patient, be it the concierge or the assessment, right? So if you look at after COVID-19 and the whole industry in Malaysia and Singapore, we are seeing the increase of adoption rate from 30% to 70%. Some of the players actually are having, increase of 70% in Singapore. That is crazy, during this COVID-19. And of course, this is because of, because of MCO, they can't go out, they are limited to home. So how can they actually access to care and to access to refill of medications, right? So that's where the mobile health, the digital health comes in place and providing this kind of, services to the end users. And this is one of the pain points whereby, patients are facing, in the public sectors, there are still a lot of patients during COVID-19 and MCO that actually defaulted the follow-up, right? And how do all these industry players, telemedicine players come into place and fill up the gap, right? To actually, provide a connected healthcare services so that they can actually continue to have a connected healthcare service with their healthcare providers, be it the high blood pressure medications and or to manage their diabetes. So this is where the digital health can come. But in healthcare, there's no way we can actually do everything online, right? It has to be a hybrid model. So how can we go O to O, online to offline, offline to online? And this is very crucial. And when we are practicing hybrid care, that makes you a very competitive, a care practitioner. And as compared to 20 years ago, where we only focus on brick and mortar care and very passive. We as a physician, we always, wait for a patient to come to us. But it's no longer that way because, is we have to be proactive and bring care to home. That will actually make the care services and the cost wise to come down. So how can we actually penetrate to the market, penetrate to the patient's home, and by leveraging on technology, be it the the telemedicine or blockchain technology for management of data and AI to make it safer medicine, better cost saving, and all your flows will be more efficient. So I think we shall actually look at technology as a tool to actually make ourselves more relevant and to make our practices more competitive, not only on the healthcare provider side, but also, for instance, the insurance side. They are leveraging a lot on technology and working with a lot of startups on telemedicine or AI companies, right? To improve, as I said, to innovate further, right? So it's to improve all the areas like, the efficiency, the safer medicine, things like that. So yeah, with that, I think I will end the session and looking forward to, discussing more and learning from everyone. Thank you very much.
Thank you, Raymond. Now we have Dr. Kuljit Singh, representing the Association of Private Hospitals.
Good morning, and first and foremost, I would like to thank the organizers, the President of KSI, Tan Sri Dr. Michael Yu, in inviting me. And also a special thanks to Tan Sri Abu Bakar, Suleiman, who I have been knowing him from my youthful days to what I am today. And he has always been very pragmatic in his approach. And the first thing he told me in the morning when I met him was, please be sensible when you talk on the mic, because we want some sensible views on digital healthcare. And he has always been a supporter. And when we had our artificial intelligence conference in healthcare last year, he was our chief guest, and he actually put the stage very well on artificial intelligence. So the first time people heard about artificial intelligence in healthcare last year, which was organized by Association of Private Hospitals. Now, digital strategies, I must say that as we speak today, COVID has got always some silver lining in our lives. And you have heard from the speakers earlier, many things we refuse to do, COVID has made us do it. Hospitals today in Malaysia, we have tele-consult platforms in some of the hospitals. And I was told that they are pretty successful based on certain guidelines that they have set for themselves, and also with what the regulators have asked us to follow. So it is not something that we haven't done. Now we have progressed quite well. If you go to some hospitals' web pages, you will see there is a teleconsult platform that patients can actually use. Now, these are the innovative methods that are adopted worldwide. They're beginning to seep in our culture. I come from a background of, I'm still a practicing doctor. I still see patients. At the same time, I'm the president of the Association of Private Hospitals. So I wear multiple caps. So sometimes my role is such that I understand what a doctor goes through, what a patient goes through, and also what a hospital administrator will go through. So I don't get confused. It kind of gives me a little bit more wisdom when I speak to people, so to speak. So digital platform actually will help us quite a bit with domestic patients. There are patients that in Malaysia, because patients are sometimes afraid to come and see doctors because of COVID. They think COVID would be something that you will catch in a hospital, which is actually a myth. You actually will get COVID from visiting your restaurants, your supermarkets, social events. You don't get COVID from a hospital. But having said that, digital platforms help these patients to at least consult doctors, follow up with the doctors using a digital platform. International patients who have been our patients before, they are not able to come. Digital platforms have made a huge difference for them as our borders are still actually closed. Now, the equation in digital strategies will not be complete without convincing the doctors to use digital platform. There are doctors who are still skeptical, but as the time has gone by, we have found that even doctors today have adopted digital technology very seamlessly. Even the senior consultants are beginning to adopt digital technology today. And once they have adopted this technology, I find that they find it very difficult not to do without digital technology these days. So it is not difficult. Many of them will ask me that, how do I convince someone who is so used with face-to-face consultation and get into, it is all a matter of time of adaptation. And it actually works quite well. Like Dr. Raymond has mentioned about hybrid. Now, in the medical world, it is impossible for one to get into 100% teleconsult, because medicine is such that you still need to see a patient, investigate the patient, you will need to examine the patient, and without that, your consultation will not be complete, both in terms of the regulator and also indemnity. There are issues, there are SOPs in the indemnities of the doctor in order to make the consult medical legally right. But we are progressing as we go along, and there are times that we find that the acceptance of the insurance companies have also increased, because with teleconsult, you reduce a lot of hospital visitation. And in that way, we find that doctors are able to see even more patients. They cut down a lot of waiting time and of course exposure of other infection. Now, there are certain specialties that we do not have issues in teleconsult. For example, psychiatry, dermatology. Some of the specialties are ready-made for teleconsult, where you do not need face-to-face consultation. And we find that those are the specialties that have adapted it pretty well. Now, the point that I want to deliver today is PPP. There's public-private partnership using digital technology. I think this is the time that we can talk about this. There's a lot of skepticism when we talk about PPP because the public sector is usually worried that buying services from the private sector would be very expensive. But this is, to me, is quite a myth when such discussions are carried out. Using digital technology, we can actually help the public sector to get their patients sorted out, particularly the long waiting list that the public patients have. The private sector has got infrastructure, they have got the manpower, and with this COVID pandemic, we have seen that those hospitals which were very strong in medical tourism, they have the capacity to accept public patients, to reduce the waiting time and also the operative time that we normally see in a public sector. Now, it is not enriching the private sector. That is what sometimes it is looked into. The buying services from private sector may probably enhance the private sector to do even better, but that is not true. So we should look at the costing, what the public sector spends on their patients, and yet they are not able to deliver in looking at their patients who are waiting for months together. Why not use digital technology? We can map up our services where the public sector can pick our services on a digital platform, looking at slots where MRI, CT scans, surgical slots that could be available, and the public sector can actually buy the services from the private sector without incurring more costs in building more public hospitals. And to maintain a public hospital, to man the public hospital, to have manpower, doctors, nurses, to retain them, it's a big challenge in the public sector. And I'm sure all governments in the world will have difficulties in sustaining economically because of COVID. Why spend more money when these facilities are already available in the private sector? We can discuss the cost. It should be reasonable enough for the public sector to pay the private to buy these services to help the rakyat end of the day. We have to be very patient-centric. Why should a patient wait 6 months, 8 months for a procedure in the public sector when the government can easily buy the services which are readily available in the private? How can you do it? Digital technology is there to help to make this partnership seamless. I can take more questions later at a question and answer, and I think that's about what I wanted to tell you all. Using digital technology in this time, I think the time is right that we should make the change now. Thank you.
Well, thank you, Kuljit. Okay, we've had what I call excellent presentations, and there's a common theme running through it. Basically, I'm not sure that they talk too much about competition, but it's the issue that with the current environment, it's pushing, it's accelerating the adoption of technology. And you have to do it. You don't have much of a choice if you want to deliver care, for example, whether it is physically, whether it is home care, whether it is remote care, whether it is telecare, whatever you want to call it, for example. And data analytics, artificial intelligence is going to be routine. You all don't realize that AI is already part of your life. But it is so pervasive, you don't even think about it. Okay, now we got about 10 minutes left. There are a lot of very experienced and very prominent people in the audience. I would encourage you all to contribute if you wish. And I would like now to open the floor for questions and comments. Yes, the lady over there.
Thank you very much, Tan Sri. Thank you very much, I think, to the speakers for an excellent presentation. I'm Suraya from Alpha Catalyst. I totally agree with you putting up the connotation to have the patients at the center of healthcare. What are the thoughts of all those on the panel, and yours, of course, Tan Sri, in terms of policies that can be put into place to ensure that providers deliver value, both for the public and private sector?
Okay, maybe I'll ask, can our colleague from Singapore respond first? Mr. Tirupathi, you there?
Yeah, I'm there. If you can hear me okay?
Yes, yes,
I
go
think
ahead.
that's an excellent question. We have seen various health systems, but let me share with you some of my experience personally with the American system. They have done a few things which I thought might be useful for us to consider. For example, in the US, payers do not get paid if there is a readmission within 30 days. And I think that's something that has been considered as a way to kind of outcome-based and value-based. And there are some of the other things as well that they do. But as we build technology, we make sure that we provide information to the care providers to see how a certain set of circumstances with the comorbidities for the patient might result in a readmission within 30 days. And we can provide a readmission predictor. We can also provide some of the other information. But providers all over in the US are now disincentivized, if I may, to kind of have someone come in within the first 30 days. I thought that was an excellent thing that Obamacare did for all the providers in those days. And the other thing which they did, they also found that the biggest cost in the healthcare system was due to non-sharing of information of the patients across different health systems. So they mandated, because US is a very large country, they have these interoperability standards which they mandated, with which hospitals are now forced and now more willingly, increasingly, to share medical information and medical records with the patients. Many countries, including Singapore, have looked at the one patient, one record, one citizen, one record rather. And so these are some of the solutions that have been proposed, where I'm personally involved in some of these projects. So
Okay, thank you. So what are you saying? You need the platform, you need the carrot, and you need the stick, so that you push towards patient-centered care. But it's more than that. What he's talking about is quite a bit about value-based healthcare. Can I just invite Mr. Rangam? Is that working? Yeah.
Yeah. Is the mic working? Can you hear me? Yeah. Okay, great. Thanks. Thanks, Tansri. And again, I think that's a very, very valid, very important question that has been raised. How do we get back value? And coming from also from an insurance perspective, but also as a concerned citizen, for me, value comes through, first of all, getting the necessary outcomes that I as a citizen, I'm looking for, but getting it at an affordable cost. Because at the end of the day, as costs go up, everybody pays for that cost. It's not just I'm paying for it, everybody else is paying for it. So the one way to really get better value, I'm a big believer in transparency, making data transparent. And I think this is something about really where common, systems, common by regulation, creating transparency. I think we spoke about the American system. One of the things that the Obamacare also did was they required all medical services to be absolutely transparently put up on the websites using common standards, common codes, so that customers get the choice back in their hand because they are able to benchmark those costs. And that increases transparency. Transparency, in my mind, is the biggest spur for competition. And competition drives better services, better outcomes for citizens. And using those common standards also actually allows common platforms, interoperability, and services to be portable across different service providers. And that, in my view, is one of the biggest stimuli, if we can, and should be a big change that comes out of this crisis, is to create those platforms and infrastructure which would require the private sector and the governments to work hand in hand.
Okay, so data transparency is very important. Measurement of performance is very important. And moving towards having your performance made available to the public is very, very important. But this requires a major shift in paradigm among the doctors and the healthcare providers, for example. Okay, Dato Kuljit, your comments please on patient-centered care.
I think the important thing here is when we talk about patient-centric care and how you regulate and the policy, I think it should come from the government stakeholders to make sure that it is regulated well. Let's break this dichotomy of public care and private care. And it should be looked as one care by itself, in the sense that it is, regardless whether it is private or public, the regulation should be across the board for all in terms of using digital healthcare. So it just shouldn't be on one-sided. And I think when those kind of policies are there, patient gets the best care. If you need to get, patient comes with dizziness or headache and he needs an MRI, there shouldn't be a thing that in the private you can get the MRI today, but if it is in the public, you wait for 6 months. So it has to be on that platform. And I think digital healthcare will actually help quite seamlessly if everybody is committed to it.
Sure. I think digital health, digital medicine is very important in this term. But look, the private hospitals and the healthcare providers got to change their paradigm. In other words, you got to change your system. Right now, the system is centered around doctors, nurses, hospital, not the least around patients. They got to change the paradigm. They got to design the healthcare system to put the patient at the center. And here we're talking about the design of the services, the design of the physical facilities, everything. Is a mindset change. Okay? Dr. Raymond Choy, your turn now.
Okay, thank you. So I think we've been talking about patient-centric care and value-based care. To me personally, I think there's a very simple formula for value-based care, which is quality multiplied by outcome divided by cost. So the value-based, the higher the value of the care will be dependent on the higher the quality of care multiplied by the higher value, better outcome, of course, with lower cost. So that is the definition of value-based care in my mind. And I think to answer Dr. Suraya's question on the policy, I think if you look at the current weather, right, where, the digital health platforms or the innovators, they are mushrooming because they see the needs. They see a lot of pain points. That's where the innovators come in, be it the local or the regional or the international. So that's where the policy is very important. We are talking about regulation. At this point of time, there's not really a regulation or really even a framework in place, right? And to govern, to regulate this space. And talking about human being health and safety of patients, and and a lot of sectors have been regulated, and this space, digital health, it hasn't been regulated. So I think it's very crucial that this space has to be regulated so that everyone is practicing safely in a standardized model. So there will be a standardized guideline so that when digital health innovators come in, they know rules and regulations so that they don't go anything too wild. But of course, it has to be a balance to strike, because you do not want to overly regulate while you kill all the innovations and creativity. But at the same time, it shouldn't compromise health and safety of our patients. Always patients come first. Yeah.
Okay, thank you, Raymond. Okay, I think the issue about data-driven decision-making in healthcare is very, very important. So right now, doctors and hospitals should analyze the data they are already collecting. Huge amount of data that they are collecting, but they are not analyzing. There's a waste of resource. The other issue, Raymond, you and your colleagues who are like-minded must work towards getting the patient to be better informed so that they are able to be involved in their own care. Okay? I think to me that's very important. Maybe develop more tools for that. Okay, we got another question here. Yeah.
I'm Zabidi Hussain. I'm a Pro Vice Chancellor for International Medical University. I have no issue with artificial intelligence. I have no issue with telemedicine. But as we doctors know, it takes more than just data analysis to make a diagnosis, data analysis, making diagnosis and treatment. It takes more than that. As a pediatrician, I know that to be able to understand a patient, you need to be more immersive. You need to be in their environment, nuances, and understanding their environment and smell and taste, So my challenge to the technology enablers we have today, are we anywhere close to that? Are we anywhere close to make your technology more immersive and to simulate the real environment of the patient? Because that's needed. And that is the basis of a patient-centered care. Can I have comments from the technology enablers?
Perhaps Raymond first.
I think the question is towards me. And the short answer is no. I don't think the current technology is able to provide that immersive environment for the totality of care. There's no way, no matter how advanced the healthcare technology is, there's no way we actually can, replace or make it a most immersive, setting. And what you mentioned is the word very important. It's a tool, right? All these technology solutions, if you look at the industry, you actually can't differentiate all of us. We are, let's say for instance, telemedicine, right? We have so many players in the region, right? We are all providing the same solution. You can't differentiate each of us. What else can it be? How innovative can it be, right? For telemedicine, online consultation, medication delivery, all this, right? So you can't really differentiate. It's actually the ecosystem that we are providing that is actually you can differentiate. And to provide immersive care, I don't think technology can replace that. But it actually can enable the practitioner, for instance, a pediatrician, to actually make better informed decision or safer practice. And when it comes to data analytics or this, right, you have lots of data to analyze your asthmatic patients, right? What are the inhalers would be more appropriate for this group of patients? While in 20 years ago, you can't. You actually based on your experience. But right now, if you leverage on technology, you have the data from the region, from Singapore, right? That, it will help you to improve your practice, because healthcare or technology doesn't stay here. It evolves. People evolve as well. So I think that's my answer. I'm not sure whether I answered your question correct. Yeah.
Okay, thank you, Raymond. Okay, look, we got a couple of questions. But Zabidi, I think if you realize that healthcare is far too expensive and far too wasteful, the type of thing that you're wishing for may well be the premium of the healthcare of the future. Whereas the other part are made available to everybody. But I don't think that technology is so limited that part of what you're talking about cannot be delivered by technology. But we don't have time to discuss about that now. There's another whole ball game for which we need to do more research. Okay.
May I just provide one perspective?
Quickly.
I think just to that point, I think when we are taking a look at technology, what we discussed in the panel is not that technology will completely take over, right? It's all about creating a hybrid model. And the hybrid model allows targeted outcomes because you are able to zoom in and increase your efficiency, and you can then follow it up with much more targeted treatments, which allows you to understand the environment that the patient is coming from. So it's not one or the other, but I think what we got to keep in mind is that it's got to be a hybrid approach. And that's what I just wanted to express.
Okay, thank you. Kwanju? Going to be last 2 questions or comments. Huh?
I just, no questions, just comment.
Yes.
With regards to the query on outcome, quality, and value. Actually, an advisory on COVID virtual consultation during the COVID pandemic was produced. And after that, there were many queries. I just read the queries. Practice of telemedicine. Telemedicine, while may be beneficial in some cases, may expose the patient and medical practitioners to risk due to limited physical examination and vital signs readings. It is suggested that the Code of Professional Conduct mention on the maintaining of standards and ethics in a virtual telemedicine consultation to equivalent or close to as possible to the face-to-face consultation. Is one comment. The second comment is, it is also suggested that if a medical practitioner, via his professional judgment, doubts that a telemedicine consultation can deliver accurate diagnosis and safe treatment, then he should proceed to arrange for a face-to-face session. That's all. Thank you.
Yeah, well, actually that's very last century. The Ministry of Health have been practicing tele-primary care since 1998, and they're still doing it. I wish they could give more input into that process, Kwanju, actually. Okay, please. Very quickly.
Say, can I make a...
Yeah, go ahead.
Yeah. So I think to answer the comment, actually, it was an advisory given by MMC during the COVID-19. But I think they are in the process of reviewing with MOH because it's not so relevant to today's and tomorrow's technology. So I think it has to be reviewed. I think and some of the MMC representative during the webinar session already mentioned, it was an advisory. It's not a guideline as yet, but we want a proper guideline on telemedicine like what happens in Singapore. Yeah.
Okay.
Thank you, Shanti.
Can I quickly add one point?
Yes, go ahead. Go ahead.
Yes. I think I just want to add to the point of taking vitals and things like that. Today, we have enough medical devices that are able to transmit via Bluetooth all the readings that are needed from a patient's home or any other location to the service provider. So I think we can make all of that happen today. So I think the distance between an outcome and the data that is needed for a desired outcome, I think is reducing quite a lot. And that's just my comment to it. So I think today all that infrastructure is available and technology can certainly facilitate it. We do provide remote patient management solutions to a lot of hospitals, and they actually do that.
Okay, thank you. Look, let's finish that part. Okay? This is all about data. Whether you get the data through the history, physically or online, or do the physical examination physically, person to person, or through the use of technology, there is no difference. There is no difference. I think Medical Council got to get themselves to understand that. For example, it is getting the data. That is the most important thing, to do it comprehensively. Okay, Please.
Thank you, Tansi. Good morning. I'm Arman from Souls Health, a mental health organization. I have a quick question/comment. This discussion is really timely because we are in the middle of a pandemic. But also, we bear in mind that the next big pandemic is a mental health pandemic related to that. All centers like ours will report a spike in clients over the last few months, and that's what we're predicting in the coming months. So how can we make sure that, or how can we get mental health to be more part of the public health discourse, and as we talk about innovation technologies? Thank you.
You're asking a very, very big question, and we should have finished 10 minutes ago. Okay, look, it's very important. The issue is, how can we use technology to help us manage the issues related to mental health? And I think the issues related to mental health under the current, what they call environment, where people are cooped up, is a major problem. Okay, that's the current, but they're much bigger than that. So I think we need another forum for that. Because our time is up. I'd just like to thank my panel members for their patience, for their contributions. It's been excellent contribution from all of you. And from the floor, thank you so much for your attention and for your contributions. Thank you very much.